Okay, today I'm going to be performing NG tube insertion and removal. The first thing is I'm going to check my physician's orders and compare those to the procedure card. I'm going to identify my patient and verify any allergies. Next, I'm going to wash my hands, put on clean gloves, and I'm going to explain the procedure to the patient and what they can expect. And I'm going to drape a towel across the patient's chest in case there's any spillage. Also putting the patient in hot towels unless it's contraindicated. And I'm going to have my emesis basin, my ice chips, my water if the patient can swallow to help facilitate the NG tube going down. Next, I'm going to occlude each nostril to see which nostril has the best patency. Breathe for me. Breathe for me. Okay, I'm going to use this left nostril, and I'm going to take my NG tube and carefully wrap it in my hand. And I'm going to measure from the tip of the nose to the ear, and then from the ear to the xiphoid process. And that's about 43. And I'm going to take that measurement. All right, and next I have my water-soluble lubricant, and I'm gonna lubricate the tip of the catheter about 3 to 4 inches. And once that is lubricated, I'm going to have the patient sit up and chin to chest and facilitate the tube downward and backwards. And I will stop the procedure if there is any kind of distress, or if the patient cannot talk, or if there's excessive gagging. Bear down for me. Just gently facilitating the tube downward and backwards, having the patient chin to chest. Okay, once the tape is to the mark and correct, we will temporarily tape the NG tube to hold it in place while we check gastric residual. I'm going to unclamp the tube and get my syringe. And I'm going to aspirate gastric contents and clamp the tube back. Okay, I'm going to just monitor the gastric contents, the color, the smell, the appearance. I'm going to take my pH strip and stick it in the gastric contents. The gastric pH should be about 1 to 4. If the gastric pH is 1 to 4, then that is a good probability that the NG tube is in the correct place. But we still need to verify that by a chest x-ray. So I'm going to tape the NG tube temporarily until the patient comes back from the chest x-ray. And then once the patient comes back from the chest x-ray and the NG tube is in the correct spot, we can go ahead and permanently tape the NG tube in the correct spot. So after I've taped the NG tube down, I'm going to check my MAR, check my physician's orders to see whether they want the NG tube clamped or on suction or feedings, pumps. And then after, I'm going to take off my gloves. I'm going to record and document the patient response to the procedure, the gastric contents, the pH, the description of